We also called on well-wishers, and in this regard, I really want to thank our Kenyan private sector, because despite the challenges that they themselves were facing, they came out strongly in support to ensure that at least the most vulnerable were able to put food on their tables. This especially because a huge part of our Kenyan workforce was casual. And many of our urban citizens rely on a daily income to sustain themselves. And we recognize this, because those casuals, with many of them now at home as a result of the lockdown, and who depended on that daily income to feed themselves, now had basically no source of income. And the big question became, how could we effectively look after this part of our population? And that, ladies and gentlemen, is how my government came up with the Kazi, Mtaani program. And the Kazi, Mtaani program was intended to put money in people's pockets in order for them to be able to sustain themselves during that difficult time. In rural areas, people had their small plots and their ngombes and their mbuzis. But in urban areas, this was very difficult. So therefore, unlike what some people tried to indicate that this was a political agenda, it was socially, totally aimed at ensuring that these Kenyans who, through no fault of their own, were unable to go to their places of work, at least would have an opportunity to earn a living and be able to continue to support their families during that most difficult time. The big question that we had was how some of our industries could continue to produce. Because as you remember, as I said earlier, this was not just a health crisis, it was also a social and economic one. And how we would keep our economy afloat despite this setback. Medical products and supplies were running low with the entire globe fighting the pandemic, and it became difficult to readily access many products. And once again, I want to thank our private sector, because upon consultation, we commissioned our manufacturing industry to begin using their existing lines to make things like ICU beds and units from scratch, to increase oxygen production, to make masks as opposed to T-shirts and other things that they were making for other markets. They started making masks, they started making PPEs, they started making sanitizers, they started making all manner of medical equipment that was to prove critical during this period. And we also realized that the need was growing as the virus was spreading far and wide, and in scales that we had not witnessed, that without, once again, the help of private sector, we would not have been able to keep the deaths to the levels that they were. We were further, as a result of that initiative, able to increase our ICU beds from, at the time, 537 to 1,353 ICU beds, a good number of those made by our local manufacturers, giving those infected by the virus a fighting chance. We were also able to build many physical isolation units, and we could transform, and as again Amit has said, some hotels and others graciously gave us access and schools to their facilities, which could be transformed into isolation centers that were affordable to the average Kenyan. Secondly, I've mentioned that, we also introduced a stimulus package, and I've mentioned about Kazi, Mtaani and where it came to. But we also realized we had to increase from those, especially civil servants and others, and the average Kenyan worker. We realized that we also needed to increase their disposable income during this difficult time. And we came up with measures such as, for all those earning 24,000 shillings and less, we released and relieved them from tax deductions, VAT, pay as you earn, and such other things to Kaondoa, so that people would have more disposable income. We reduced our VAT by 2%, just to mention but a few of the actions that we took to help ease the pressure on Kenyans. And by the way, I must also recall that the Kazi Mtaani program went a long way, not only to help provide an income for many thousands of Kenyans who were out of work, but it also went a long way to help us prevent a lot of diseases that were related to dirt and filth, illnesses like diarrhea, cholera, malaria. By extension, we were fighting coronavirus, putting money into people's pockets, but at the same time, we realized that that action was also helping us deal with other common diseases that had afflicted many, especially in our urban centers. And most importantly, it kept our youth away from indulging in crime-related viruses. So, ladies and gentlemen, these are just a few of the measures that we took. But I also want to talk a little bit about vaccines. Because when news came that vaccines had been found and were available, that good news that was spread on CNN and BBC and everywhere else, making us all totally very excited, we soon realized that that news was not for us on the African continent, it was for others, since these vaccines were not available to us. But we were told now how they are available, but the good news, unfortunately, was not for Africa. We couldn't access. And so, at a continental level, we sat as an African Union, convened meetings, and for the very first time discussed how would we as Africans avail ourselves of these much-needed vaccines. To cut a long story short, after many numerous discussions, working together under the coordination of Africa CDC, we were able to find adequate vaccines for our people. But that would not have been possible without the coordination and the collaboration of Africa as a whole. This was a great eye-opener for many of us. And at that stage, I must appreciate the African Union under the leadership of Moussa Faki and the then Director General of Africa, CDC, for recognizing that it was important that the Union come up with a framework that would spearhead the development and access of COVID-19 vaccines to Africa. Again, at that time, I was the chair of the Organization of African, Caribbean, and Pacific States, as again has been said by my brother, Dr. Davis. And for the very first time, we managed to pull together with the nation states of the Caribbean and the Pacific, who were also facing similar challenges to ourselves, and worked closely with them to make vaccines readily available for them as well. And in this, it was the first time since pre-independence that Africa and the Caribbean had collaborated so closely to face a common threat.